are hiding your legs because of unsightly, even painful veins, there is something you can do about it. Here to explain is Dr. Gary Kirsten from Optima Vein Care, who was also named as one of Phoenix Magazine's top docs in the Valley. Good morning. It's good to see you.
Good morning, Lisa. Good to be here with you today.
Thanks for joining us. This is a perfect time of year. We're talking about varicose veins.
Absolutely.
So many people suffer from them. What causes them?
Varicose veins are generally genetic. If mom and dad both had varicose veins, your odds of having them are greater than 70%. So the number one thing is genetics.
So we want to get that taken care of. You're the man to go to. You've been practicing this for many, many, many years.
Right.
31 plus years.
I did OB for a number of years, and then I've been doing this for the last 4 years exclusively, and very comfortable with it.
Okay.
And we get very nice results for our patients.
Yeah, there's a lot of people who definitely have them that want to get done with them. So you said genetics is a big part of it.
Correct.
Okay, well, we have an animation that kind of explains also what else can be causing our varicose veins. Tell us what's happening here.
What we're seeing here is a valve in the vein. The veins in the lower extremity have valves that keeps the blood flowing up toward the heart. As we stand on our feet, the blood will tend to go backward. That increases the venous pressure, and the valves will start to stretch. And when that happens, the valves can let the blood flow backward. Then the veins get even larger, and it's a relentless process to where all of a sudden we get symptomatic legs, we get bulging veins, and we have a lot of problems that can occur from this.
What are some of the signs that we have this going on?
The various signs that we see, number one sign we look for is pain. If the patient is experiencing pain in the legs, pain with walking, pain with movement, also swelling of the ankles, they can get also some heaviness, cramping, throbbing of the legs, itching or burning. A lot of patients in Arizona think itching is dry skin. It can also be from the veins. But the bulging veins is certainly a big sign of it. And then restless legs may or may not be related to the varicose veins.
What are some of the other risk factors to getting these kind of veins?
Some of the other risk factors are blood clots. If we get large veins that just hold the blood there, we can see clots that can break off and go into the system. We can actually see ulcerations of the skin. If the blood flow is not correct and the skin breaks down, we see ulcerations that are very hard to clear up.
Wow, and then obviously we talk about family history. Unfortunately, the women seem to get more of these than...
We seem to see it more in women, but we also have male patients. Obesity can certainly contribute. Age, actually, the average in this country is 50% of patients that are adults will have varicose veins, but above age 60, virtually all patients, we can find varicosities. Pregnancy can make it worse. Prolonged sitting or standing can make it worse. Now, somebody that's standing and moving around is going to have less chance than somebody that's standing in one position.
Is the treatment different for pregnant women?
We see it in pregnancy for several reasons. Number one, the change in hormones can create weakness in the veins. Number two, there's an increased blood volume in pregnancy. And number three, the pressure of the baby can actually help to compress the veins. In pregnancy, we don't do all the treatments. We can still do some of them, but like chemicals in the veins, we don't use in pregnancy. But still, if somebody experiences this in pregnancy, we would like to see them as soon as they experience it in the office to go over some things, do an ultrasound, get them fitted for compression hose.
So that's the sort of thing you can do while you're pregnant, but the other type of therapies you should wait till after you have the
pregnancy,
baby?
correct.
Let's talk about those. What are they?
The treatments we do are endovenous laser therapy, to where we actually put a laser catheter in the vein to close it from within. This would be in a large, deeper vein. We can also use sclerotherapy, where we inject a chemical in the vein that essentially will cause the blood to stop moving in the vein. Then we also have another technique where we can take out small segments of the large, bulgy veins to make it all go away faster. That's called a phlebectomy.
Wow, what about downtime for these kind of procedures?
Minimal downtime. Most patients can come in, be treated right in our office, and return to work within 12 to 24 hours.
So it sounds like the technology has gotten a lot better.
Technology has gotten much better. The old-time vein stripping is no longer the standard of therapy. Now we have an in-and-out procedure.
Okay, now we're going to look at some before and after pictures, and this might be you in some of these before pictures, and you want to take care of this now. We'll take a look at this, and I have seen that a lot.
Yeah, on the left side we have a
ropiness.
large ropey vein. This vein has been treated, and several weeks later the patient returns, and you can see that the leg looks better, but most importantly, the leg is going to function better for this patient.
Will they come back after they're treated?
Unfortunately, since it is genetic, there is a chance they'll come back, but hopefully they're not going to come back as large or as intense.
I see. And what about insurance? Will it cover this kind of procedure now?
The larger veins, the veins that are refluxing, are covered by most insurance plans. If a patient comes in and we do an assessment, we take ultrasounds in our office, we can submit that to the insurance, and in most cases we'll get coverage.
And Doctor, what makes Optima Vein Care so different than all these other places that are around
I like
town?
to think of us as one-stop shopping. Once the patient comes in our door, we'll do everything. everything. We do the ultrasound right there. We do the procedures right there. We do the follow-up right there. And we not only treat the big veins, but if the patient has concern about little spider veins, once we treat the big veins, we'll go all the way down until the patient feels better and is happy with his or her looks.
Wow, and how many Valley locations are there?
There are 3 Valley locations for the Optima Vein Center. There's one in the West Valley by the 101 at Thomas, one in the North Valley by the 101 at Princess, and then there's one in Chandler on Elma School.
That's great. So see, if you're sitting there and you've been wearing pants all summer because you hate to show off your legs, now you can have beautiful looking legs by getting these treatments done. So easy now. Thank you for sharing that with us. Good information. And there's a special offer, is that true?
We are doing free screenings for patients. If a patient is not sure, maybe they've got little spider veins or some of the little purple veins, they're not sure if they've got deep veins that are causing problems, they can come in and get a free screening. We'll actually do an ultrasound, and if there's nothing going on in the legs, they're not out anything. If we find something going on, then we can talk about treatment of the larger veins and then the smaller ones.
Okay, there's a lot of misconceptions out there about what causes the veins. Now you know the real story. Like crossing your legs is okay, doctor says. Thank you for that.
You're welcome.
If you would like more information on Optima Vein Care, go to their website. It's optimaveincare.com. There is the phone number right there on your screen.